Autism. What is autism? Autism spectrum disorder is a developmental disability that impairs a person's ability to understand social cues and communicate or interact with others. It impacts the nervous system and could range from mild to severe. Level 1 requires support from therapy due to difficulties with communication, changes in routine or behavior, and social interactions or activities. Level 2 requires substantial support and has difficulties with both verbal and nonverbal communication. Level 3 is the most severe level of autism, requires support and sometimes a caregiver. Therapy and medications are beneficial. Diagnosis. To be diagnosed with autism, a doctor has to look at the individual's developmental history and behavior. This is because there are no medical tests to diagnose an individual with autism. ASD is commonly diagnosed and detected at 18 months or younger. By age 2, a diagnosis by an experienced professional can be considered very reliable, but many children with autism do not get a final diagnosis until they are much older. Prevalence. About 1 in every 59 children in America are diagnosed with autism. Parents who already have another child who has ASD has a 2 to 18% chance of having another child with ASD. ASD is more common in boys than girls. 1 in every 37 boys versus 1 in every 151 girls are diagnosed with ASD. Autism is harder to be diagnosed in girls because some signs are commonly mistaken as shyness, stubbornness, or labeled the child as quiet. This is because of the stereotypical characteristics girls possess. This wouldn't go unnoticed in boys because they are typically loud, extroverted, or have a large amount of energy. Causes and risks. Scientists have found that genetics have a large impact on the probability of someone having ASD or having a child with ASD. Individuals with genetic or chromosomal conditions such as Fragile X syndrome or tuberous sclerosis have a greater chance of having ASD. Valproic acid and or thalidomide intake during pregnancy have been linked to a higher risk of ASD. Children born to older parents also have a greater risk of having ASD. Physical activity and its barriers. The fitness level of an individual with ASD may be lower than someone without ASD. Individuals with ASD will engage in physical activity with support. Some barriers include not initiating play, anxiety, defensive or distractible, difficulty in group activities, and may have a hard time to understand and listen to instructions. Inclusion in community-based fitness programs. Motivation, engagement, and interaction. Explain what is going on and what will happen during the program. Have patience and be willing to explain the instructions for more than once. Go at their pace and understand their limits. Many individuals with ASD respond to positive reinforcement and reassurance. Having other individuals complete a task in partnership with an individual with ASD will encourage friendships and engagement. Modifications for fitness assessments and inclusion. Bring awareness of ASD to other people involved in the program. Teamwork with program staff, family members, and caregivers is crucial to successful inclusion. Incorporate program modifications that allow the child with ASD to share activities and experience with other participants. Be flexible. If something doesn't work well, be prepared to try again with something new.